Happy Wednesday. Thank you for being back with us today for another episode of Wellness Wednesday Inspiration. My name is Fernanda. I'm here with Dr. Linda, and we have a wonderful, interesting, amazing, knowledgeable guest today. Super excited about having Dr. Jeff with us, and Dr. Linda is going to do an introduction. But today's topic is a different approach to overcoming mental adversity. And I think we all have been in those situations where something's happened in our life, and many times we find it difficult to overcome certain things. And today's all about how to overcome any type of mental adversity, any type of adversity in life, and how to really regain that mental balance. So Dr. Linda, how are you doing today?
I'm great. Happy Wednesday. Always good to be here with you. And you know, it's my favorite day of the week because you and I get to chat and we get to learn from our guests and even from each other. So I'm really excited about being here and, you know, kind of storming the warm weather here. I know we had a monsoon this past weekend. You probably did too, right? In your area.
I did. There was a lot of rain.
So yeah, so we're kind of loving the cooler weather right now. So I'm good if it stays less than 108. I know that sounds hot for some people, but we're pretty happy here in the desert if we stay below 108. It's awesome. So, well, I'm excited about today's guest, and you personally got to meet him, which I'm a little bit jealous, but I feel like just before even just getting on here, just chatting that we're like three peas in a pod because what we love to do. But our guest today is Dr. Jeff McNairy, and he's very seasoned at what he does, definitely. He has 30 years of experience in mental health, especially working with women with sexual abuse, acute psychiatry, drug and alcohol abuse, which, you know, all of these are very rampant. He worked for UCLA Medical Center. He even from there with the doctorate of psychology and also has a master's in public health. So very seasoned at what he does. And currently, what's exciting, he's the chief medical officer of Rythmia. And Fernanda was just there and she shared a little bit in previous podcasts, but I really want to get into that today because it is a different approach on how you work with, you know, mental health. And sometimes mental health has a stigma, but mental health really is just overall health of our mind. We'll let Doc really dig into that. But working with plant medicines, I know has been very instrumental in my own life and a lot of people that I love and care about. So I'm excited to dig in with this with Dr. Jeff.
Yes.
You want to bring him on?
Jeff, thank you for being with us.
Doc.
Thanks for having me. I'm excited to meet with you.
Thank you. Thank you. And Dr. Jeff, I do want to ask you, back in 30 years ago, when you started kind of going to school and figuring out what you wanted to do, what prompted you to go on that field of mental health, especially specializing in the fields that you specialize in? I mean, when people are in alcohol and drug, when people had experiences of sexual abuse, you can say that a lot of those people have hit rock bottom. And it's, you know, a lot of people have considered them challenging as a society in general. So what made you kind of just decide to go and specialize in those fields?
I started off my education doing medical anthropology. So that was a really interesting degree because I got to see that healthcare is much more than just a symptom. It has to do with culture, social stigmas, belief systems, regions of the world. And I studied indigenous Latin American ethnobotany at the time. So I got to see Latin American culture from a medical perspective and how different indigenous groups looked at the way that the illness is defined. And so what I was noticing in the Western model that I was in, when I was studying at UCLA and other schools that I was getting my degrees, they weren't looking at the whole person. They were just looking at symptoms and then treating those things. And I understand that's an approach of the West because of liability and capitalism and all the reasons we know that that's the way it goes. But it wasn't satisfying for me as a student to see that nothing was really changing. And so that's what kind of set the stage for me to go into these different areas of patient, sort of the kind of patients I like to work with, and the type of approaches that I took, which were at the time not really that orthodox, you could say.
So when you were younger, did you know that you wanted to get into medicine, or did you enjoyed just being around people, helping people? Were you one of those kids that everyone went to when they had a challenge and you kind of try to figure things out for them?
Yeah,
what was that like?
In my neighborhood, I was definitely the empath of the group who would help people. And I grew up in a very rough part of Los Angeles back in the 70s. And right now it's not so rough, but it was really rough when I was a kid, and I had to stay safe. And so I learned how to stay safe by taking on other people's sort of burdens and energy and connecting with them. And that was a defense tactic that I didn't know I was even doing at the time because I was just a kid. But it developed into this sort of practice of caring for other people and really connecting with them on an authentic level that I didn't really fully understand until probably 5 years ago.
Wow. You mentioned about the study of Latin American cultures and cultures in general when it comes to different ways and approaches to medicine. What has been the most eye-opening thing that you have encountered with seeing medicine through the lens of different cultures and how different cultures approach healthcare in general?
Something that I really love about the cultures that we're dealing with now with this indigenous Latin American plant medicine, and also just my own background in Latin American studies and healthcare, is we believe, and I believe a lot of the indigenous groups that I work with believe, that all illness, all discontent, all addiction and things that go on in our lives are a result of being disconnected from yourself. And so society has moved towards disconnection and being not plugged into yourself as an individual. And the reason for this is because governments and big businesses, especially pharmaceutical industries and things like that, they want to be able to provide a service for you. They want to be able to guide and take you down certain roads, sometimes not for the benefit of you. And it's to sell products, and it's to kind of, it's just how the system works it takes away individuality. And so what I've learned about with indigenous groups I work with, and also with the plant medicine I'm doing, and also Latin American culture in general, is that plugging into yourself and being connected to yourself means that you're actually grounded in who you are, and you see things for what they are. You have better discernment, and you're not at a point of dis-ease. You're at a point of ease. And that's how you can stay healthy and you can honor your true self. So that's a big part of how I've always approached healthcare, even though I was in these systems that weren't really allowing it too frequently. But I knew in the back of my mind, that was my goal. And I had to kind of jump through the hoops per se, of getting my clinical hours and getting my degrees and all that kind of stuff, where I had to sort of play the systems game, but then get to a point where I could make a shift and hopefully help a lot of people in a way that's really meaningful.
So you've been in the health field for 30 years, but the last 5 years you've been at Rythmia, and I definitely want to hear more about that. But for those 25 years in practice and having to follow guidelines from insurance companies in order to get reimbursed, because unless you go out of the system and have like a concierge practice, then it's a little bit difficult because it's almost like you have to follow a script, right?
Yes.
And how you even talk to patients, and you can't even entertain certain ideas that, that you can, like with Latin America, in the Latin American cultures, and having experience, doing some work in Ecuador and Peru and working with healers in Mexico. It's so different.
Yes.
So how did you what did you do that was, I'm sure I could just tell, if I had a problem and I needed to talk to a doc, I'm like, you'd be the guy that I would call. And somehow I know that I would get some answers and just feel more calm and have a plan. How did you navigate all that with knowing that there was something beyond just what you could give them at that point?
Yeah, well, first of all, it was extremely frustrating to begin with. Luckily, the types of patients that I worked with were very open-minded people. I consider so-called addicts to be some of the most emotionally in tune and sensitive people on the planet. And women that have sexual trauma are looking for empowerment. So they are very much eager to have success and move forward in ways that they can feel safe and be back to feeling like they can control their lives in a healthy manner. So in the acute psychiatric people, I believe are shamans, actually. So I look at them differently. I don't look at my inpatient schizophrenic guys as something horrible that they have. I look at them like they're very insightful and they're very connected. Now, they're in a system that doesn't benefit them for sure. And we have to help them succeed in that system. Absolutely. So there's some logistical things that, of course, practical things you have to do. But it was my approach that I had and the view that I had of my patients. I did not view them as ill. I did not view them as lost causes. I didn't ever view, not one patient that I ever worked with did I ever think, this person will never get better. I never thought that, ever. And what I noticed around me was there was a lot of that type of thinking going on. And clinicians, because they get burned out of the system they're in, they just kind of go through the motions and it just becomes routine. And when you're in a healing center, a rehab, a hospital, a practice, and the actual clinical staff don't have confidence in your healing, you're not going to get healed. It's very hard to. And so I just always had a different approach in myself to how I viewed my patient population. That was kind of the platform that helped me get to where I'm at now.
So you saw the possibilities instead of how everyone sees limitations and diagnosis and puts a name on them and labels them. When you're labeled, you're limited. When
Correct.
You're not, you're unlimited. And I think that's awesome.
I would take like unorthodox approaches for some things that I could within reason. Like if I have at one time in the drug and alcohol place, I had a lot of patients who were kids going in and out of jail. And so we would approach them in a way of to like how to stay safe in jail, but also how to come empowered and not do longer sentences. So I just was always it was a combination of harm reduction, but with actually validating the person and who they were as an individual.
Mm-hmm. That's awesome.
And that's just to show that your perception really can influence not only your own outcome in anything that you are in, but also somebody else's outcome.
Definitely.
Especially if it comes from someone who they perceive as someone that has a position of power. And as in the traditional medicine, Western medicine, when doctors say, well, you don't have any cure, you have to take this medication for the rest of your life, you only have 6 months to live. That's the power that it's being taken by the client or by the patient, and they believe those things that are being said or those things that are being presented to them. So by you presenting something different, by you presenting a different situation or a different possible outcome, it changes also the outcome that they would have for themselves. And yes. I do want to ask you, you mentioned the disconnect and all diseases and everything happens from that disconnect. How do people get disconnected with themselves?
Most people will have this disconnect occur for the first time between the ages of 2 and 7 years old. And this is not just a concept that we discuss at Rythmia, but it's something that's pretty widely accepted within psychiatry and psychology and also sort of mental health in general, is that there was either a traumatic event or a traumatic environment or a misunderstanding that a child has that they learn in that moment that they have to take care of themselves emotionally, or that they have to show the world a different version of themselves in order to stay safe. So an example of this would be, like, let's say I don't get any attention from my caregivers for whatever reason. Let's say it's not abusive, it's just abandoning. Well, I learned that if I start to be silly and make everybody laugh, that I get the attention I need. And so I learned this at age 4. And then I'm always silly. I'm always the fun guy. And I'm always the interesting, silly jokester. And I use this, and it starts to develop and it becomes my personality. But it's really not who I am. It's something I had to use to get an emotional connection with my caregivers, which is so developmentally important. And that's a nice example of something like that. Whereas other people, they go into drugs, they go into bad behaviors, and we show the world something. It's our ego that is kind of masking our true self, And so that's something that happens to everybody. And some people, it happens very dramatically because of serious trauma or abuse. And others, it's not so bad because, let's say, caregivers were amazing, but they just were busy working and a nanny raised them, for example. So there's just different sort of scenarios that occur.
So how do you dig into something like that? From 2 to 7, there's a lot of people that don't even remember. I don't know if it's intentional. Sometimes it's their intentional blocked memories, and working from a Western medicine perspective compared to something as extreme, which I think is amazing plant medicine, specifically ayahuasca. I mean, just 2 different extremes. And I mean, how do you figure that out? I know I want to talk about the plant medicines for sure, but what about when just in traditional medicine? How do you pull that out of a person?
Well, I think what happens is what I've come to understand by working with so many people over the years is that, especially with trauma people, is that during a traumatic era or a traumatic moment, there's emotions present during those traumatic times that get in the way of behaviorally surviving that event. So if I'm being abused, my fear is crippling me. So I have to push my fear away. Or let's say my anger that I might feel being abused, that's not going to be received well. It's going to cause more abuse. So I push that away. And I push these emotions into the amygdala part of the brain that stores our subconscious processes. And then I go about my life. I'm not 5 anymore. I'm 25, I'm 30, I'm 40. And those emotions are influencing my day-to-day through the prefrontal cortex, which is my conscious, logical, rational self, without me being aware of them. And I don't trust people, and I pick poor relationships, and I have low self-esteem, and I'm always searching for something that I never can quite find. And then I go, okay, something's wrong, or I start to develop a drug or alcohol issue. And then I go to therapy, or I try some techniques, methods, antidepressants, you name it. And what I might hopefully learn is that I have some unresolved trauma. I have things that are influencing my life now that I need to work on. But the problem with that is, how do you get to those emotions? How do you get to them in a safe way? Because if I'm the patient, I'm going to receive trauma therapy. Well, I better trust my caregiver. I better trust my therapist. I better trust this group home that I'm in, or this rehab. It's hard to do that in a quick way. I had a lot of patients of mine that had trauma from childhood that took them 5 years to actually lower their guard and connect in a therapy session with me. That's way too long. That's just way too long. We got to have something quicker. But how do you help people feel safe and to be vulnerable when being vulnerable meant danger, right? So there's this it's very, very complicated. And that's where meditations come in, and hypnotherapy can be helpful. And there's these other things that are kind of a little bit more work on the subconscious level that we all know are available to us a little bit more so now, thank goodness. But they're expensive. They're hard to access for most people, and most people just don't even believe them anyway, right? So it's like a niche community that really has the patience or the access.
You mentioned about the disconnect. I want to go back to that because I think it's important. And a question came to me: what about the person who comes to you, or maybe it wouldn't come to you, because what about the person that has the perfect life, quote unquote, right? Raised perfect parents, perfect environment, all kinds of things happen. Are they disconnected? And so how would the disconnect happen? And how would that person even know that they're disconnected if in their minds, their perception is that everything in their life was like rainbow and, blue skies. So
yeah. And we've had a few of those people here at Rythmia, actually. And they're usually here supporting a family member, and they're not here for themselves, right? And those types of people often don't make it into therapy. But if they did, and if they came to Rythmia, for example, what they would see is that hey, they might have a great life. They might be really happy, and that's great. But self-awareness and progression of knowledge and connection is an eternal, infinite process, in my opinion. And so you can always become more grounded. You can always tap into more self-awareness. You can always become full of more love, right? So there's always these things you can always work on. And it doesn't mean you have to be broken and at your wit's end, suicidal. None of that has to be the picture for everybody. But there's an infinite wealth of knowledge and self-awareness that can occur through these methods that we're talking about.
Wow.
That's really powerful because we all have some sort of challenge within us and sometimes we're looking for everything outside of us. So how is this really different now that you're primarily working with plant medicines and overseeing that and working with people who maybe have gone the traditional way and like you're saying, this is taking too long, I just don't get it. Can you explain a little bit of, why this became, for you, it's like an aha moment, probably, that plant medicines, like, this is what I want to work with and how I want to help people? Because I always believe that when you're in the healthcare field and you go into the field with the right intentions, especially when you're a healer, you never retire, so to speak.
Correct.
You're always going to be helping people because it's a calling.
That's right. Well, what's interesting is people have always asked me, especially like later in my career, they say, you must have an amazing life because you're a psychologist and you've worked with so many people and you've helped so many people. It's like, wrong. I don't. I have the same issues everybody else has. I have the same struggles and the same. Then they say, well, why can't you use the same techniques or advice on yourself that you use with everybody? I said, because I'm not my own therapist. I need another person to work with me. And so that's what's beautiful about plant medicine, is that you become your own therapist. And that's why it's so empowering, because like you mentioned with external sources of change that are needed in the Western model, external specialists, external meds, external environments. And if that stuff is positive and helpful, then the assumption is we will change within. Maybe, but not necessarily, right? So we have to change within. And how do we do that in a safe way? Well, if I can sit with myself and have a mirror image of me and talk to myself and give advice, that's really powerful. And that's what happens with the plant medicine and the program that we're doing here at Rythmia. And there's a lot of things that do that. Breathwork does that. Meditation does that. Mindfulness does that. There's a lot of things that can do that. Not just plant medicine, but there's a lot of avenues to achieve that.
The plant medicines just work faster.
Yes.
It seems like we were talking about that, Fernanda and I, because I had told her, I've worked with the plants years ago. And then recently we both had gone to a retreat. It was a meditation retreat. And I loved it. However, we say that the meditation, hypnosis, because we're hypnotizing ourselves, I think, on a daily basis with our conversations and our words, it seems like those take longer, whereas the medicines are just, bam, they just hit you right between the eyeballs and show you what you need to know and at this moment. And sometimes you go and you're trying to fix something that you're not there to fix that. Something else shows up in your life, to fix. So I know that it's such a there's just a different spectrum of how quickly you can get into the challenges. So what would you say for a person that maybe can't, work with the medicines?
What I always recommend is that if they can do holotropic breath work, that is very fast too and effective. Now, there's certain medical conditions that prevent people from doing breath work as well. What we're noticing is if people have a seizure disorder, that could be problematic with breath work, or if they have certain heart conditions, that could be problematic. So you have to obviously check with your doctor first on anything like that. But breath work is something that's very, very, very effective, that if people that don't have access to plant medicine.
Okay.
Dr. Jeff, how does that work? Can you explain a little bit about how, from the moment someone decides to do ayahuasca and actually do it, how does it help healing trauma or even physical ailments? How is it that the plant medicine heals?
Well, on the medical side, which is what I study a lot, and then I've learned from the shamanic side, the spiritual side, by being here in Costa Rica with all these amazing shamans. The medical side, there is not a lot of studies done because ayahuasca is a Schedule I substance in most of the world. However, there are some really good studies, and I've been able to find about 13 of them. There are peer-reviewed journal articles and legit studies that are done. There's a couple new ones out this month that are really good too. And so what's being shown medically for healing is that ayahuasca is antiviral, it's anti-inflammatory, it's antibacterial, it's antifungal. It also activates T cells, because T cells, which are our immune system's cells that fight off infection, they have a port on them for a serotonin molecule to click into, which activates them. Dimethyltryptamine, which is the active ingredient in ayahuasca, DMT, looks almost identical to serotonin, and it has a similar organic structure chemically. And that can also click into the same port that for the T cells to activate them. So people can cleanse their bodies of illnesses. We've had guests report that their autoimmune disorders dramatically reduced or even went away. And there's this overall health feeling, clarity, eyes become bright white. There's a lot of like health related things that can help with ayahuasca. It pulls mercury out of bones, which is like unheard of. They don't have any cure for mercury poisoning when it gets to your bones. So this is an amazing sort of medicine on a health level, as well as a spiritual, psychological level.
That's powerful. I would love for you to share with me some of those studies. I'm such a geek when it comes to looking at, and especially with, okay, awesome. Especially because with a lot of the research out there, it's done on mice and, very controlled study. And it's like, as humans, it's really difficult to do a study because you can't control humans, what they're trying to do now, and
Correct.
create separation with vaccinated, unvaccinated, masked, unmasked type of thing. But it's very difficult because we're always changing.
Correct. There's a brand new study out that's looking at gene expression and epigenetics regarding ayahuasca, which is really exciting.
Wow.
Can't wait to dig into that.
Yeah, I'm excited to see the results.
Can you tell us a little bit more about Rythmia? What is Rythmia? What can someone expect to go? Where is it located? How do you get there? How many days? All of the information about what is it about? What is a day-to-day consist of?
Well, just to kind of start that off, it's like the reason we even exist is because the CEO and I went to a place in Costa Rica that was it wasn't a medical facility. It was just a house up in the mountains. And it was a beautiful experience with the medicine, and the shaman was amazing, but it wasn't a safe or medically sound or even clean place. So we wanted to have a place that was legal, safe, medically supervised. And so that's why we opened this place. And it took us a couple years to really get the license going. But we have medical doctors here, nurses, paramedics, EMTs, tons of medical staff who, but to tell you the truth, they're actually quite bored most of the time because it's such a safe medicine and it's such a great staff that they just play dominoes most of the day. They're not doing much, which is good news actually. So when people come here, they have to be medically cleared beforehand. And when they book their stay, they're on the phone call with a representative of ours, and they go back and forth with myself and Dr. Arturo about certain health conditions or med issues, the certain meds they have to be off of. And we just kind of talk to them about their overall health before they get here. Then we clear them, then they fly down, and we're located in Liberia Airport of Costa Rica is where they fly. And then we're about an hour south of there on the Pacific side near Tamarindo, is a little town. And it's in the state of Guanacaste. It's a blue zone. So blue zones are really healthy regions of the world where the air is clean, the water's clean, and there's certain rights of animals that are awesome. And it's just like a healthy place. And then they check in on a Saturday or a Sunday, and they stay for a week. And they leave the following Saturday or Sunday. And we do another medical triage, sort of physical here when they arrive. And we have all, for the COVID time, we have all the COVID protocols in place. We test people when they get here. And they immediately go into a breathwork session that evening. And that sets the stage to help them ground and connect and sort of begin to process what they're here for. Then Monday morning, first day, we have a class that helps them set intentions, explains what the plant medicine will be like, gives them pointers, clues on how to guide the ceremony for themselves. And then they have 4 ceremonies, Monday, Tuesday, Wednesday, Thursday night. And during the daytime, they're resting and getting massages, eating super healthy organic food that follows the dieta, which is the way to eat to prepare for the medicine. And they're also in meditations, and they have yoga every morning. And then after they have their 4th ceremony on Thursday, then they go to more breath work on the weekend, Friday night, Saturday night, and then they usually leave on Saturday night or Sunday. And so during that week, there's lots of support. There's lots of holistic staff. If there's something that escalates, emotionally, we have a team ready to talk and do sessions with them. So it's like a really safe container. It's clean. It's safe. It's beautiful. You've been down here. Fernanda, you were here, right? So you saw how clean it was. It's awesome. Yeah, and we're right by the beach. We get the ocean air, and we have different kinds of rooms depending on the price you want to pay. And the Maloka, where we have the ceremonies, is beautiful and it's safe, and everybody has their own area and their own mattresses. There's plenty of restrooms, and it's just a great setup. I mean, it is the 4 seasons of ayahuasca, you could say.
And that sounds amazing.
I wanted to say, who is ayahuasca not for? Aside from like medical, if you're not clear, of course, if you have a medical condition and you cannot participate, but who would not benefit from ayahuasca? Would anyone benefit from it?
People that would not are people that have certain psychiatric issues. Those are kind of the only people that wouldn't benefit from it, because it could escalate them and make them a little bit more psychiatric. So there's a few diagnoses that would not be appropriate for that. And then people that have, I'm thinking of other diagnoses. It's kind of more psychological, psychiatric stuff. But as far as health related, if people are healthy, everyone will benefit from it if they're healthy, in my opinion.
Great. So
I'm taking notes on all this.
If anyone wants to find out more information about you, about Rythmia, about ayahuasca, about mental balance, anything like that, where can people find you?
If they go to Rythmia, LAC, or Rythmia Life Advancement Center, or they just search Rythmia on the web, we have a website. We also have a Facebook page, and we have an Instagram page. And in the Facebook, Instagram, and our website, there's all the information about what we're doing down here, how to get a hold of us, how to book a week, and how to prepare for the week-long stay, what to bring, how to eat. And also, we talk about the meds. If you have to come off of certain ones, and we refer you back to your prescribing physician, and we'll talk to you about different things. So the web, the website, Facebook, and Instagram are the best ways to get a hold of us.
Wonderful. And we have a question from someone in the audience. What about panic or anxiety attacks? And I think the question is more about whether or not that would be an influence against being able to participate, or would it help also?
Well, some people will have panic or anxiety attacks based on a bipolar 1 diagnosis, and some people will have panic attacks or anxiety attacks without a bipolar diagnosis. So what I'm looking for them is a level of serotonin that might be very elevated on a consistent basis. And that's usually a bipolar 1 diagnosis. So if people occasionally have panic attacks, but they have a career, or they're high functioning people, and they're not on meds necessarily for it, or maybe they take an as needed benzodiazepine to help them in those moments. Those are people that we can absolutely work with. If someone has a bipolar 1 diagnosis and they're mostly in a manic elevated state, those people are usually on mood stabilizers that bring them down into a healthy range of behavior. And it's too risky for them to come off those meds, which are contraindicated with ayahuasca, to come and do the program. So, but we like to go a case by case basis. So if someone has occasionally a panic attack or just has anxiety, which a lot of us do, right? That's not so abnormal. Those are definitely things we can work with. And we have a suggestion sort of system that we can plug you into.
Wonderful. Barry, I hope that answered your question. Thank you for the question as well. And thank you, Dr. Jeff, for amazing information. I enjoyed Rythmia very much, coming from someone who just went, I think, less than a month ago, actually.
Yeah, you were just here. We miss you.
Yes. I had the experience of my life. It was amazing. And it's not just about the ceremonies, but everything that Rythmia has to offer, from the food, the amazing food from Meg and the staff, and just everything. It's just wonderful. I'm going back, and I know that, and I'm calling it for next year, early next year. I'm coming back.
Excellent. Thank you.
I had a quick question for you, Dr. Jeff. When you went and experienced it for yourself, was that did that change your whole perspective, how you were practicing, mental health? When you went, I was like, oh my gosh, this totally just blew the doors wide open for you.
It was funny because Jerry, the CEO, was there with me, and I was crying like in the early morning hours, laying there, and he comes up to me. He's like, "What's going on?" I said, I just wasted 18 years of my life going into debt, $250K to be a psychologist. This medicine works. It's 20 years of therapy in one night. That's what I said. Now, clearly, I was in the moment. I've definitely used my background in a great way, right? But in that moment, it was so crystal clear to me that this was a huge tool that could be very beneficial to people. And I do say, it's like 20 years of therapy in a night. It really is like that.
Mm-hmm. Yeah. And the beauty of it, what you mentioned earlier, is I'm taking notes because it's been at least a couple of years since I've worked with the medicine, but just a reminder and thank you about the power of breath work.
Mm-hmm.
And that can just be so powerful. And we had a gentleman who you're probably familiar with Wim Hof and some of his work.
We've had a lot of his facilitators here doing weeks of Wim Hof ice plunges and breathing. Yeah.
So, and that's super powerful. And I mean, that's something that you can learn, and you don't have to go there. But I really believe that when you immerse yourself in a place like Rythmia, I mean, it's just there to just marinate you with love and just really have that transformation, but also the support of others, because you hear of stories. And sometimes healing even occurs from just someone sharing something that happened through their experience there. And I know that happened with me, something I shared with the group, and it almost gave permission to the other person to let go of something that they had been holding on to for years. So it's amazing. And then people that are watching, I'm like, yeah, you have to go and experience it. But I definitely want to go and experience this in Costa Rica. It sounds amazing. So
we'd love to have
you. Hopefully I'll see you soon.
That'd be great. And the energy of the group is so important. It's so important. We see that every week happening. It's beautiful.
Awesome.
Yes.
All right. Well, thank you so much. I don't know if there's anything else you wanted to add, Fernando or Dr. Jeff. I mean, this was awesome. Appreciate it very much. And anything else?
Well, we have one last thing I can say that I think is important is we have three main intentions that we teach the guests that are sort of umbrella intentions that cover usually all of the personal intentions they bring to the table. And they're very simple. And the first one is show me who I've become. And that's where we want to see this part we've been showing the world that's taken on its own life, right? We want to see that, like authentically see it. And then the second intention is merge me back with my soul at all costs. And that's the coming back together and the lack of dissociative abilities, and it's coming back connected. And then the third one is heal my heart, which is getting all the pain released and the trauma gone and the fear and all that stuff. And when people do this, we call it, they had a soul merger. And then they report on their survey when they leave if they achieved this or not. And our average is about 95%. It's actually 96% to date since we opened up as a company. So it's a crazy good success rate that I never thought was possible in healthcare. I'm used to like 12% success rate, in my fields, but the amount of success that's happening here, self-reported, is mind-blowing. So we'd love to have everybody come down here and check us out.
Yeah. Wow. That's awesome. I love it.
That's powerful. I mean, you go with an intention, and really, if you're willing to participate, if you're willing to go with the program, if you're willing to open up, and if you're willing to be vulnerable, there's gonna be healing, no matter what. But you're gonna come out a different person than when you came in. And I think everybody, whether they experienced the soul merger or they did not, I can tell you that I think. And Dr. Jeff, you can tell me, nobody walks in the same person as walk out the same person as when they walked in. There is a change,
Correct.
no matter what, big or small, but there is a change.
Absolutely. That's very true.
It's impossible to be the same person after you experience plant medicine. And that's something that I can attest to as well. And one more thing, Andrea was asking, will the episode be available to watch later? We post in YouTube. We also posted in the podcasting platforms, all of the major podcasting platforms, as well as on Facebook. So it will stay on Facebook, on Dr. Linda's page and my page. So it's always available to be watched at a later date.
Thank you. Thank you. That was very nice. I appreciate it. Thanks for having me.
Absolutely. Awesome. Thank you so much. And just, I think we don't want to let you go. There is one more question.
Sure.
Would this be helpful for someone who's bipolar with infrequent manic episode once a year or two and is not medicated?
If it's bipolar 2, then it's not an issue for us and they can come. And we have to, again, look at them individually and see when their latest attack was and how long it lasted. And there's a couple of questions we would investigate further on, but usually that's fine. And since they're not medicated, it's likely it's bipolar 2, I'm assuming, and that's not a problem.
Awesome. All right. Thank you so much, Dr. Jeff. Thank you, Dr. Linda. It was an amazing episode, and we will see you all next week.
All right. See ya. Bye.